tested complications of cast care, let's just talk about general cast care. We use the acronym CAST, C-A-S-T. C is for clean and dry, never wet, especially with a plaster cast. Key terms is to cover the cast with a plastic bag for bathing. Huge Nclex tip. Once again, especially for plaster casts. These typically take a long time to dry and will fall apart if wet. A is for above the heart for the first 48 hours. This is done to decrease the swelling and prevent compartment syndrome. So key terms, elevate the extremity. Huge Nclex tip. S is for scratching an itch. We always use a hair dryer on the cool setting. Never put anything under a cast to scratch an itch. So big Nclex tip again, write it down. We always use a hair dryer on the cool setting for any type of itch. Lastly, T is for take it easy. So take it easy, man. Especially when the cast is initially put on. So no bearing weight on plaster casts, especially in the first few hours. This can misshapen the cast. And no finger indentation or pressure on the cast when it's initially put on, as well as no hard surfaces. Again, this can distort the shape of the cast and cut off circulation. So Kaplan mentions, a newly applied plaster cast to the lower extremity. The nurse takes which action? Elevates the legs on pillows and leaves the cast open to air. And Saunders mentions, which cast care instructions for a plaster cast applied to the right forearm? Select all that apply. Keep the cast clean and dry. Allow the cast 24 to 72 hours to dry. And keep the cast and extremity elevated. Yes. Next is itching under the cast. The client's statement indicates an understanding of appropriate measures. I can use a hair dryer on the low setting and allow the cool air to blow into the cast. Yes, never put anything under the cast to scratch an itch. And the third question, the nurse teaches a client who is going to have a plaster cast. Which statement by the client indicates a need for further teaching? I can bear weight on the cast in about 1/2 hour. No bearing weight when it's initially put on. And lastly, after the application of a plaster cast, which statement indicates that the client understands proper care of the cast? I need to avoid getting the cast wet. Yes, always keep it clean and dry. Okay, next we have crutch and cane training. Always a huge focus on the Nclex and most nursing exams.